Today on how is Canadian healthcare, I need an MRI to see if I have a fucking brain tumor. And go ahead, guess when it is. Go ahead, guess. It's in 2026.
I knew there would have to be some kind of downside to free healthcare. That is absolutely insane. By then, she might be dead.
2026. My MRI to see if I have a brain tumor is in 2026. It's March 2025 right now. And if you thought this was bad, it's actually worse than you thought, because the appointment where we decided that I need this MRI was in December of last year. So it's not like it's 10 months from now, it's 13 months. It's a 13-month wait.
Healthcare in general is messed up. So while we're dealing with outrageous costs for healthcare, they're dealing with outrageous wait times for healthcare, which, guess what, has the same outcome. People die. This is disgusting. And I feel like it really doesn't have to be this way. Like, we should be able to afford healthcare while also not having to wait until we're about to die or already dead to get our appointments that we need.
To see if I have a brain tumor. At first, I just thought this was a mistake because having an MRI every year is like a monitoring timeline. Like, I already have an MRI every year for my spine tumor, which is why we think maybe I have a brain tumor too. So I was like, hey, they just made a mistake and scheduled this on a monitoring timeline. But no, I called and the clinic was like, yeah, the doctor actually requested that you have it earlier, but this is the next spot we have.
The grass is not always greener on the other side. Everyone keeps romanticizing these policies in these other countries, but they don't live there, so they don't know how it actually plays out. This is the problem that I have with everyone thinking that because they see this country has this and that country has that, it's so much better than the United States of America. Go live under these different systems. Because what you'll find is that there's BS everywhere and not everything that glitters is gold. I guess you just have to decide what matters more. Being put on a payment plan for overpriced healthcare, or literally having to wait so long for care that you need right now, that you need immediately, expeditiously. Both are absolutely messed up. And like I said, I don't think it has to be that way. Insurance companies, if they were nonprofit in a way that like their CEOs and people that work for these companies cannot make so much money off of sick people, like this would be so much better. No long wait times like what they're having in Canada apparently, and no outrageous bill costs. And also we need to figure out, why are they charging so much? Like, let me put this into perspective. If you go to the store and buy some diapers, you know, they're kind of expensive, right? But if you compare how much these hospitals are paying for the exact same diapers, you will be flabbergasted.
We're seeing about 13 months for these brain and spine MRIs. Cool. Cool. Canada, where healthcare is free, but only if you can afford to wait.
And not everybody can afford to wait. This is absolutely sad. I'm not even gonna lie. I feel so bad for sis. Hopefully she can go somewhere else and get those scans that she needs so that she can get the care that she needs. And even then, if she's trying to get her care done in Canada, if the screens are taking this long, how long is it taking to actually get the care to intervene with these different illnesses? See, the grass is not always greener, and I'm gonna need Americans to start appreciating America a little bit more and understand that just because something seems good on the outside doesn't mean that it actually is. There's corruption everywhere on every level. You're not gonna find a system that is a utopia. There's always going to be BS that you have to put up with. And this is a perfect example. I feel so bad for sis, and I hope she gets the care that she needs immediately.